cancer doesn't spread because it's poked by a biopsy needle. And I really want to explain this because I know how scary that thought can be. When doctors do a biopsy, they use a very thin needle to remove a tiny piece of the tumor. And that sample tells them if it's cancer and what type of cancer it is, which gives them the information they need to give the patient the right treatment. That basically decides over life or death. It's important to know that for cancer to spread in the body, the cancer cells have to actively break away, which means invading surrounding tissue, enter blood vessels or lymph vessels, survive circulation, and then grow somewhere else, which is a very complex biological process. It's not caused by a needle touching it. You know, a tumor is not a water balloon filled with loose cancer cells that spills out when you poke it. It's actually a solid mass embedded in tissue. Very solid. So, in very rare cases, a few cells can be displaced along the needle path. Usually that area is always removed during surgery. There are actually very large studies that show that biopsies do not have a negative impact on our survival rate. If biopsies really would cause the cancer to spread, we would know it, because outcomes would look very, very different. I know, when you are newly diagnosed, there are a lot of people who tell you this and that. You are very sensitive, you are scared, you want to protect your body from anything that could make things worse. But biopsies are so important because they give doctors the important information to know how to treat you. And that knowledge is power, not danger. Do you think different? And if yes, why?